Great herbal day, herb lovers. Today I'm going to do a very informative and funny little video on questions or facts, frequently asked questions. Yesterday, if you go to my site at herbsista, herbsistah.com, you will see there's a little box there that you could chat. So yesterday, I had a sister that got on and said, I'd like to ask you a few questions. Okay, so this little chat turns into an hour and a half of one more question, one more question, one more question. So I thought because it was questions that people ask all the time that I would do a video, and she was so cute and so sweet about what she needed to know. And I recognize, that some of the things that I take for granted and that a lot of us take for granted when you're first starting on your womb healing journey, it's a big deal. And so just want to take a few moments and like take it back and calm down and go to the beginning for people who need the beginning. And if you need the beginning, I'm Dr. Ashay. That's the beginning. Okay. So I want to do this little talk about these questions that I had with R yesterday. And yeah, you're going to have a little fun with this. Okay. So she says, yeah, my friend said that you have some products that can help shrink fibroids. So yeah, the womb detox tonic. It helps to shrink, break down, and remove fibroids. Well, most people don't believe that. So they got another question. How does that happen? Where does it happen? How long does it take? Okay, so how it happens is that the body built the fibroid without you. It didn't need you to build it. So if you give it the right things, it can get rid of it without you. And you don't even have to know anything about it and how it's coming out or anything. But most of us are very controlling. We want to be involved in it on some level. And guess what? Our body does a lot of things without us. So we don't have to consciously understand how it works. If you do the right things, it'll happen. Okay, so taking this womb detox tonic, you take 2 ounces in the morning and 2 ounces at night, and it helps to clean out all of those old toxins. And we talked about the toxins are emotional and physical. I would even say spiritual. The toxins are from going through the drive-through, eating, so eating takeout, soy, stress, and just not being happy, not creating the life that you want. This is what fibroids are about. So even though you're going to take the tonic, you have to do something else about the other things. You have to do something about, if you hate your mama, hate your husband, hate your job, hate your commute, hate your apartment or house, you got to handle those things. So asking me, like we'll go down on here and say, asking me how long it takes, it's different for everybody, right? It would be different for everybody because your emotional connection to the stress and to the things that's going on in your life, you're handling it different than the next person. So if you don't get your mind in gear for another job or for to break up in this relationship or to tell your mama leave, get off your back, I'm a grown woman, then it's going to take you longer because you're going to have the same stressors working on you all the time. So you don't want to, if somebody tells you it's going to take 3 months or 4 months or 5, they're lying. Let's just say that. Okay. I try not to lie to people. No, I don't lie to people. In fact, I'm known for telling people the truth. Actually, what they call it is what is it? Um, truthfully honest or painfully honest. Painfully honest. That's what people have said about me. I'm painfully honest. Okay, or what is it? Another one is that she says no pepper, no spice. I do give you the whole conversation, no spice. Anyway, um, so she says, well, you know what? She got a scan and she wanted to, since she got the results and she knew that she had something going on, She wanted to know if I was familiar with adenomyosis, adenomyosis. You got to do the Latin. I had to Latin. Adenomyosis. Okay, I heard of adenomyosis. It happens to be the new flavor of the month. You know, a year or so ago, everybody was being diagnosed with lupus, and now everybody's being diagnosed with adenomyosis. And one of the things that I thought was pretty amazing about adenomyosis is that it can be part of having had fibroid surgery that kicks this whole thing up. And what it is that you have tissue from um, the endometrial lining that's going into other muscles in your body, even within the womb. And I should have brought my womb poster over here. I need my womb poster, whatever I'm talking about. And one of the things that can cause it is having had myomectomies or any surgery on fibroids. And I thought that was pretty amazing, that you thought you was doing a solution to the fibroids, and actually you creating a whole nother diagnosis. That's part of the reason why you do as much as you can without having the intrusion, because all kinds of stuff can happen, all kinds of stuff. And I don't like to scare people, and I don't want to fan the flames, but you want to do as much as you can, because the body put it in there, and the body can get it out given the right substances, right foods and everything. Okay, so then that's what I told her. It's the new ailment of the month. Everybody has it. So then she says, okay, can this womb detox tonic help with it? It certainly does. Any issues dealing with the womb, excessive bleeding, pain, excessive cycle and days can be helped by the womb detox tonic. You know, it is very good at minimizing the days, helping you to sleep better, helping you to have more energy, better bowel movements. It is a really good tonic for that. Okay, so then because, as I said to her, even though they give it a name, you know, adenomyosis, it's still toxins, and toxins are toxins, and what you need to do is clean those out. Okay, so then she says, okay, I have a few more questions. Okay, this is after we only talked for like 5 minutes. You know, we were chatting for an hour and a half, which is very unusual. So she was asking about the womb detox V caps, the veggie caps. Those are for women who are traveling. You really do want to take things liquid when you first start, because you want them to get throughout the tissues, and liquid starts to work in your mouth. You know, digestion starts in the mouth. That's why we have, you know, digestive juices here, but here we call it saliva, but that's digestive juices. And soon as it hits your saliva, it starts taking it through your system. And so you want that, especially when you may have a distended abdomen, and you may not have good digestion, good bowel movements, or any of that. So you need to help yourself with liquids as much as possible. And you also need to be on digestive enzymes, which helps to break down the fibrous tissue. You want to be on probiotics, which is good bacteria. And good bacteria for women who have womb issues is helping you to eliminate some of that yeast. All women who have womb issues have an excessive amount of yeast, and that excessive amount of yeast is helping to grow everything in the womb and in the body in general, because some women, they have, you know, acne and skin issues and other things, you know. So it's easy to absorb. It's good for your body to have something that's easy to absorb, because it's already having a lot of hard times and other things. Okay, so it's just, you know, you take 2 ounces before breakfast and 2 ounces before bed, and you can add a special dose sometime during the day if you need to. And I was just letting her know that a lot of times when your doctor says, okay, we're going to look at it, you know, the scan, and then we're going to have you come back in and discuss your options. Let me say, most of the time, The options are very limited. The options for when they give you the adenomyosis diagnosis is that the only solution that they find that they think they have is a hysterectomy. And so I mentioned that to her. Do you know that that's the treatment that they think that they have for this is a hysterectomy? And most women, she says, no, I want to, oh, no way. I want to have a child. So a lot of women think that the doctor is going to have some other kind of things that they can do. But whenever you're dealing with surgery, you're dealing with scar tissue. And when you're dealing with your womb and that whole sensitive area, African Americans, people of color tend to scar and get, all of the lumps and what do we call the lumps when you have the huge scars from when you get your ears pierced and all of this? I'm trying. Keloids. We keloid very easily. So if you were to think about that, in that surface of the womb, if say for instance that this were the surface of the womb, if you had a cut here and then you got a keloid or a scar here, nothing could attach anywhere in this area. So that's how during pregnancy, that's what happens is that the egg and sperm come together from the fallopian tubes, come down into the womb area, come down into the womb area, and if there's scar tissue here, there's not going to be any attachment. So it's going to come all the way out, and you're going to have your cycle, and it's going to keep happening like that because you have scar tissue. Now, I've helped women who have had myomectomies with a scar program so that they didn't get scars and they were able to conceive, but that has to happen like days after the surgery. You can't like get your 6 weeks checkup and then say, okay, what we're going to do for the scar. You got to do that like the next day because, that's what healing is. Healing is the tissues coming together, and sometimes for some people, the way it's going to heal is with a scar. So, got to do that right away. Okay, so she was like saying, how long does it take to start shrinking them? That's lifestyle. How you eat, your stress, your exercise, all of that creates your health, So you can't, say you're going to keep eating hot wings, which I got a whole video I need to do just on hot wings. But suffice it to say that hot wings are poison. All of the drugs that they put in the chickens, they put straight in the wings. And it seems that people who like them are addicted to them because of the drugs, so they want to eat them all the time. And what you're doing is filling your body up with growth hormones and all kinds of antibiotics and other kinds of drugs. So hot wings are a no-no. You cannot have hot wings, no matter how good you're doing. Okay, so then she says, well, does it also have to do with the size of the fibroid? Of course it has to do with the size of the fibroid, how much time it's going to take. But what I tell people is to eat clean. Eating clean means no beef, no pork, really even no chicken unless it's organic, and the best fish you can buy if you're going to eat fish, because you want to reduce the amount of drugs. So that you see how hot wings are not in this category. Even though it's chicken, it's not the kind that we're talking about. It's not good. So then it says, so I send out a womb detox guide, and I'll give you one to you if you email me at info@herbsista, HERBSISTAH.com. That's info@herbsista.com. It's a womb detox guide, and it's got stories of women from years who have passed fibroids, who have given their story, their testimonies, where you could see the fibroid. I'm going to get this fibroid. Okay? Let's see. I'm going to get this fibroid. See that? That's a fibroid. One of my clients passed vaginally through using the tonic. Now, sometimes it can come out in any other way through your bowels, and you have all your systems of elimination, your kidneys, spleen, liver, skin, lungs, and bowels. So it's going to come out in all kinds of ways. There's not one way that we can determine that it's coming out. So that's why knowing how long it's going to take is not what we know. But what we have to do is make sure that everything, all of your organs, all of your systems of elimination are clear, open, and working, so that when things start breaking down, there's ways for it to come out easy, you know. Okay, so then she says, well, you know what, I'm anemic. Yeah, you bleeding, 7 days heavy, you're gonna be anemic. And most of the time women are so happy that the bleeding has stopped that they don't realize that your cycle is every day of the month. So even though that part where you emit is over, you're building now for your next cycle. So you got to build your blood all month. You don't just build it during the time when, the week before your cycle. Every day you need to build your blood. And women who find that they bleed for 7 days, but then they stop and then they drip for maybe the whole month, that seems to happen when your blood is low. So you need to, I have a blood builder herbal, fiber blood builder herbal that's really good. I have several Emory medical doctors that send their patients to me to do this. Why? Because it gets your blood up really quickly, without an infusion and that type of thing, because it is, your body sees it as food. Your body sees it as food, because it's got alfalfa and beets and orange peel and, all of these things. So your body absorbs it, and it's in with flax meal. So your body absorbs it just like if you were eating a meal. And that's what you want. You don't want these hard rock, pharmaceutical iron pills, because they constipate you, they give you hemorrhoids, and they're not absorbed very well, and your iron doesn't get up significantly. It doesn't. So the best thing to do with anemia is, I remember too, grandmothers, you need to be eating collard greens, turnip greens, some kale every single day. That should be your breakfast and some other meal. And then you also need to be drinking the pot liquor. Remember grandmothers and their pot liquor? Anyway, um, so when we talk about eating clean and organic, she said, does that mean only eating organic meat or no meat at all? And um, I often am amazed that here you are trying to just get your body together, and you already thinking about 7 months down the road as to, once I get these fibroids gone. That's one of the things she said in here. Can I go back to eating the other stuff? I just want to do a side eye. If it got you in that situation, why would you want to eat that again? You free. You free. You don't have to do that anymore. So no, you can't go back to eat the other stuff. But what I say, um, you know, is that everything that you put in your body has to be as clean as possible, including your hair products and your cleaning products, because all of those things is in your house and you're absorbing that too. When you spray, when you pour bleach, or when you can spray it, that's, you can smell it. That's why we've been raised to think that's a clean smell. When you smell pine and all of that kind of stuff, we know, okay, the house is clean. But some of those things have endocrine disrupting hormones that are causing you to have your hormones out of balance. And having your hormones out of balance is what's contributing to fibroids, you know? And in fact, one woman the other day asked me, she says, well, a woman told me, she watched a YouTube, she says, one lady on here said that she used red clover only and she got rid of her fibroids. Number one, everybody is not the same. She obviously, that worked for her, but red clover is, it needs to have a balance because it is a hormonal herb. But when you are blending them, because I have red clover in my formula, but with the other herbs, it's balanced enough so that the receptors, the hormone receptors that we have in our body that's supposed to have estrogen on them, is able to get that from the red clover. That's a plant source of estrogen. You don't want that estrogen receptor to take on a phony estrogen, which is considered a xenoestrogen that comes from plastic or makeup or shampoo or cleaning products. You want it to have a phyto, which is plant. Phyto is plant. You want it to have a phytoestrogen. So that's what the red clover is able to do. It's able to clean off that old phony synthetic estrogens and put on the plant source. Okay, so there's a need for it, but not women who have fibroids. Their bodies draw an excessive amount of estrogen from the environment and from everything. So their bodies are extra sensitive to estrogen. So, so they need something to help them balance it out and clean it out and move it out. So that's the point behind detoxing. Womb detoxing is to get rid of the excess estrogen. Okay, so so when I'm talking to her about of all the things that you need to take in your body, you need to make it as clean as possible. You also need to pay attention to the fact that some of the things that you are reading and listening to, some people don't know what they're talking about. I don't know how else to say it, or sometimes these things may have worked for them, but it might not work for you. You really want to work with somebody who can give you an explanation as to why some of this stuff is working. Why? A little explanation at least. For them to say, well, it worked for me and that's how it works. No, that's not true. Your body obviously was totally excessive in the excess estrogen, and that might have helped you some. I'm not telling you not to go try some red clover, but if you get a spurt of growth in the fibroid, that's why. Okay? And so then she wanted to ask me, is it gluten free? Yeah. Gluten is not in everything, even though the advertising, and that's one of the things we have to recognize, is that we've been taught much of what we know about nutrition and food and everything from 60-second commercials from food manufacturers. So a lot of times what we know is what they want us to know. It's not the truth, So gluten is not an issue for everybody, but guess what is an issue for everybody that they don't want us to know, which is, the things that they're putting in our food, genetically modified. That's the issue. Now, they want you to know all of this about gluten, but they don't want you to know that they're putting, genes for shrimp in your tomatoes, so your tomatoes can stay hard and never go squishy and never rot. Well, a lot of people can't have seafood. So if you say that I can't, I can't eat tomatoes, it might be you can't eat those genetically modified tomatoes. And it's a lot of foods that have been inserted with a gene from something else that has nothing to do with that food, so that it can have the characteristics of that food. That's what the problem is in a lot of cases. And they don't want you to know that, but they want you to know about gluten-free, right? Okay. This is why we gotta think, research, and I don't mean research just watching videos. I mean go and read something, I read a lot of scientific reports, a lot of, proceedings from medical conventions and conferences. I read all kinds of stuff, so these things fit together because everything fits together. Okay, so let me just tell you what else me and this sweetheart had a little conversation with, and I realized everybody needs this. Sometimes you need an herbal education consultation. That's me. You need to set up an appointment and talk to me about what's going on. I had a whole hour of questions to ask you because I need to know about lifestyle. Because lifestyle is you. Lifestyle is your health. If your oldest son is getting on your nerves since he was 5 years old, that's causing stress. And every time you see, hear, or your phone ring, your stomach start hurting, that's going to create stress in your body, which is the fight or flight response. And the fight or flight response creates the hormones that grow fibroids, So if you always like this, always ready to run, always feeling stressed out, and you growing fibroids every time you have to catch your breath or feel your heart beating fast or any of that, you know. A lot of us are feeling stressed because we are good girls. Not me, but there are a lot of people who are very much interested in pleasing their mama, and they 45 years old. You pleasing your job, pleasing your parents, your mama and your daddy, pleasing your no, you grown. Stop trying to please people. You know, do your job to the best of your ability at your job, but trying to make people happy by saying yes all the time to everything that people ask you, and taking on extra work and jobs and responsibilities, and you got too much going. I find that women who have fibroids, they do more for everybody else than they do for themselves, and they never tell people no. They always are willing to be that person to take on an extra project. You can't do that. That's not fulfilling your life purpose. You're not here just to do everything for everybody else and nothing for you, you know? So you have to tell people no sometimes, and you don't have to have a reason, and you don't have to smile, and you don't have to see if it's okay with them. You just can't do it, you know? And that's that whole good girl syndrome. You got to get rid of that. I got rid of mine probably when I was like 18, after I cussed my daddy out and left the house. That probably was when I got rid of mine. But you have to figure out how to do it, but you got to cut those kind of things where people have so many expectations of you that it's causing you a lot of stress, the good girl syndrome. I think, again, I want to say, I think that Women's March, I talked to another woman yesterday who says she thinks that the Women's March had really gave her a freeing around that. Well, yeah, I can imagine that a lot of women, that was like a socially stamped, again, here it is. Everybody got permission to be free, but if it works for you and you feeling good and you feeling powerful behind that, that's great, because that's what needs to happen. That's why we have girlfriends and sister circles and stuff. You talk to these women, and that's a good solution too for your stress. We talk to these women and we tell them what's going on in our lives and everything, and they love you. They love you truly. They're not just trying to get in your business. These are people that you really know for a long time, or that you have a connection with, and they say to you, girl, no, don't do that. Then okay, she's got my best interest at heart, and I can listen to her. I call it getting a reality check sometimes. I have a girlfriend I do that with. You got to have people that you do that with, that you can trust, that won't run your business, um, because that's more stress. So she said on here too, do I stop eating cheese? Yes. All dairy is part of the issue. Now, if you want to eat organic, that's one thing, but I think sometimes you need to just cut the whole thing. A lot of times people have these cravings for cheese and bread because it feeds the yeast. Remember I said earlier that the yeast is part of what the issues are. They don't recognize that it's feeding the yeast, but they realize that they got to eat cheese every day. They got to eat bread every day. If you put a basket of bread in front of them, they will eat the whole thing, So, that's part of the issue with the yeast. I told her that she needed to just go vegetarian. Now, I'm not advocating just going vegetarian. I was a vegetarian for many, many years, but I do eat fish now because I feel that it works for me, my brain, and everything that I do. I'm a very high energy person. I know you couldn't tell, but we want to give ourselves as much as necessary without going over the line and feeding the fibroids. And that's also why you have to do a parasite cleanse, because parasites are asking for the cheese and the bread, and you got to kill them so that they can stop asking for the cheese and the bread, But if you go vegetarian, at least you could go pescatarian, meaning that you eat fish. You will feel better, and you will eliminate all of the things that's feeding the fibroid, And then she told me that she tried to do vegan with another program, but she couldn't do it. So you do have to be committed, and that's why these things are emotional too. We are connected to the ways that we eat because of our grandmothers and our mothers and all of that. So you can't just say, well, you know what, okay, I don't mind not eating X, when you know that every time you ate X, it was because, you know, you were sick and your mom had went and made it special for you and everything. So every time you eat it, you feel like she's there. You know, we do have an emotional connection to food. Okay. She says, stupid question. But if I do this with the vegetarian lifestyle and then my fibroids shrink, does that mean no more meat, even fish? And I gotta say what I said. I put a long girl, you know, take it one day at a time so you can heal. Don't try to think about the rest of your life when you're just trying to think about this 2 week time that you're getting ready to go and talk to a doctor about your scan and what's getting ready to happen. And you know you want to have a baby and you want to, you know, you got these plans. So thinking about how long you got to be vegetarian is not productive, you know. And then this is one thing I like to say. My fibroids is not a term in my life, in my practice, in the women that I work with. Why? Because it's not your fibroid. You don't own it. You don't love it. And you don't want to keep it. Our bodies hear everything we say. So if you're saying my, the body thinks, okay, this is part of us. This is what we need to hold on to. It's not yours. You don't want to keep it. It's not your fibroid. Okay. So it's the fibroid. Okay. So we want to get the emotional and the mental thing set up properly. Okay. So then she says, she said, yeah, oh, LOL. Okay. So then, and then she kept laughing. Ha ha ha. I went tee hee. So then we're going back and forth laughing. But she said, you're easy to talk to. I work with somebody who was rude when I tried her program from Atlanta. She said, you may know her. And I said, I'm sorry about that. And I have to tell you, I do say I'm sorry. Why? Because sorry has a spiritual aspect to it, I think. And people love to have an apology. Apologies reverberate throughout the system and it kind of soothes your soul. You know, we look at, you know, entire groups of people, you know, want apologies for wrongs that's been done against them in the past. And people feel a sigh of relief around an apology. You know, so whenever someone tells me that they've had a bad experience with anything, I always say I'm sorry. And that's something that we can do as a love thing to each other. When somebody tells you this happened and you say, I'm sorry about that, and you'll see them visibly take a sigh, you know, it works. But I said, you know what, I'm sorry about that. And I said, who was it? She told me who it was. And I can't even tell you how much of this practitioner's people that I get because she's mean to people. But what I'm saying to you is that what I was just saying about women who have womb issues, they take a lot of unnecessary mess from people. You know, they tolerate a lot of things from their doctors, rude comments. And see, all of this stuff is coming into the womb. The womb is the creative center. It's like a guttural kick. When you're working with anybody or dealing with anybody, if they're rude to you, you're a grown woman. Fire them. That includes your doctor, your dry cleaners, whoever it is. If they're rude to you and you, first of all, you need to bring it up. First of all, you got to say, excuse me, is that necessary? Okay, so then that gives them a chance to know that there was something wrong, because a lot of women who have fibroids, they don't speak their mind. They don't put they don't say what they need to say. They tell me, they might tell their girlfriends, but in the meantime, they hold all of that. And all of that stuff goes right into the orange creative chakra and stops it from creating. You know, that's where the womb is. We'll talk about chakras another time, or you can find another one. But that creative chakra is a issue with women who have fibroids. And she told me this other healer who has, she told me she saw her on a YouTube and she was rude to her. You know, so I, you know, fire people who are rude to you. Anybody, Anybody, your doctor, everybody, just ask them for your medical records right there so you don't have to pay $2 a sheet for them later. Take them with you, and then the next doctor you go to, you got them, okay? So do not tolerate rudeness. And you don't have to be nasty. You could just say, excuse me, and then you say, well, you know what? I don't think that this is going to work. That's not how I like to operate. This is not going to work for me. So can you give me all of my medical records, please? You know, yeah, that's how you do it. And then also, let me say this too. When you go in and they say, well, we need to schedule you for a myomectomy or for hysterectomy, this is the way you get out of it so you can think. You know, I have this whole thing called WombLoveOlogy, which is the art and philosophy of loving our wombs. 97% of African American women by the age of 65 will have had a hysterectomy. That's because of that good girl syndrome. We have certain people who we feel are authorities, and whatever they say, we just go along with it. You know, we don't think that we can question it. So one of the things that you do when you go to your visit is that your annual is that you take somebody with you who believes what you believe. So that could be one of your sisters from your sister circle, or it could be your womb advocate, you know. And what happens is you have a list of questions and things set up in advance. And she also knows how you feel, so that when the doctor starts asking you questions about, you know, setting up other procedures and things, sometimes our brains leave our bodies and we're thinking about other things. We call it an out of body experience. But you can have that person, your womb advocate, talk for you. They got a list of questions. So, and then your final thing to say before you don't have to schedule, this is how you don't schedule, is to say, well, I have to pray on it. You don't even have to be a prayer, but that's what you say, because nobody will question your religious beliefs in comparison to signing up for surgery. So that's all you say. You say, well, let me pray on it and I'll get back to you. And then they'll let you go without a whole bunch of harassment. Because, you know, a lot of women tell me it's very challenging to get out of there without some type of appointment. And then they usually make it and then just call back later and cancel. You don't want to do that. That's one of those things I'm saying to you about speaking your piece. Speak it, you know. Okay. So I want to tell you, of course, you know I have a YouTube, but sign up for my new YouTube station. And I refer other sisters to me. You don't have to figure out how it works and if it's going to work for you. So many of us, 8 out of 10 women, are having some type of womb issue, and they're suffering in silence. I have so many stories about this. I have one event I was doing. These 2 women, they were breaking their booth down. I was breaking mine down. And each one of them wanted to speak to me separately. Turns out that they were partners in this group that they had. And they sat right across from each other at a desk. Each one of them had had a hysterectomy and the other one didn't know it. And they sitting across from each other for years. You know, I know that in families, there are a lot of women who have hysterectomies and they just say that they had female problems or female issues. You need to know your womb story. You need to know when your mom, your aunties, your grandmother, you need to know when they went through menopause, what age, so you'll know what you're looking at, you know. One woman that I was familiar with, she ended up finding out that her mom went through menopause as she was going through menopause, and she was like 37, you know. And so she had to hurry up and have the children that she wanted because she thought she was going to have this other life, but now it wasn't going to happen because she needed to start having her babies if she wanted them, you know. So you want to do everything you can to put yourself in a power position, because I call this revolutionary womb wellness. Why is it revolutionary? It shouldn't be, but just doing something like the womb detox tonic, which is a proactive way of keeping your body from growing fibroids, because we know the environmental toxins are out there. If you don't have it, keeping them from growing. If you have it, to shrink them without surgery, like using the womb detox tonic, and also to basically speak your mind and use your energy in your life for you, That's revolutionary. Telling your doctor, no, thank you, give me my records. That's revolutionary. You know, telling people what you think for a lot of women is revolutionary. You know, so this whole philosophy that I call WombLoveOlogy is revolutionary because we haven't been doing it and we need to. So I asked her, I said, how did you hear about me? And she says, well, one of my girlfriends heard you on Tom Joyner. Thankful for that. Thankful for that. But women usually talk to women about what works, you know, so tell women about this. Let them see it for themselves. Pass this video along. Put it in your social media because we can't allow us to go down the way we are and thinking that when you're 34, 35, that you get my hysterectomy. There's no hysterectomy set up for you with your name on it. You don't naturally have to have a hysterectomy in your life. That's not normal. A hysterectomy is extraordinary, but we've made it normal. And if you don't have cancer, you know, you don't need a hysterectomy unless you have let things get so far gone because you kept researching. That's another thing. I'm going to tell you, sisters, I love you. Of course, you know that, you know, but sometimes women are constantly doing research. And, you know, I had a sister once call me and she says, I talked to you a while back. I said, she says, a couple months ago. I said, a couple months like how? Long ago. Was it Christmas? She said, no. I said, was it fall? No. I think it was. I said, was it summer, June? No. It turned out to be a year and a half ago. Of course, I remembered the conversation because that's what I do is remember things. But you don't recognize how fast the time is passing and the fibroid is growing every day. So why are you thinking about, let me look at this, let me look at that, let me do this, you know, let me go on vacation with my family and when I come back, when you're doing all of that stuff, you're putting yourself in an untenable position, meaning that you're putting yourself between a rock and a hard place, as my daddy said, you know, you're getting yourself in a place where you have no choices. That's why we want to do this as a proactive movement and work on detoxing our wombs all the time. At least if you don't have fibroids or a womb issue, you need to be taking the womb detox tonic at least for a month or so and then take off a month or so. Then do it for a month or so. I mean, because you're dealing with the environmental toxins every day, all day. You know, so this is not extraordinary what you're doing when you're trying, but what is extraordinary is we live in extraordinary times. We already know this. And what happens is when you have Baltic whales with fibroids, when you have pigs with fibroids, you know, all females on the planet got fibroids. So that means something. That means that the planet is toxic. And we know that. And I'm not trying to be Chicken Little and run the flag, you know, the sky is falling or anything. There's things that we can do. That's taking your power back when you recognize that there's things we can do. That's why revolutionary womb wellness is so profound, because we can stop this. We can stop it. 97% of African American women having a hysterectomy is an epidemic. It's crazy. And we got to do something about it. And it's us who are going to do it. Sisters got to save themselves. Nobody going to save us. We got to save us. So we got to all pick up and do what we can. So this is what I'm doing. Y'all do the best y'all can do. Okay. So send it around. Talk to people. Detox your wombs. Don't get between a rock and a hard place. You know. Okay, so I'll be doing a video. Look for them. Tell your friends. I'm Dr. Ashay. Did I give you my phone number? 404-244-5565. That's 404-244-5565. Not your fibroid. The fibroid. info@herbsista.com. And my site is Herbsista, HERBSISTAH.com. I see you soon. Ovario. Have a great herbal day.